Hello everyone, I am Dr. Sagarika, consultant neurologist, SCPM Super Specialty Hospital, Gonda. Today we will discuss about epilepsy. Epilepsy is a condition where a patient is having recurrent risk of seizure due to a chronic underlying condition. When a person is have two or more unprovoked seizure, then he is considered to be having epilepsy. Epilepsy is generally two types, focal seizure and generalized seizure. The causes of epilepsy are, it may be due to genetic causes. In children, it may be because of birth hypoxia or high-grade fever. In adults, usually it is because of head injury, CNS infection like tuberculosis, neurocystic sarcosis, or because of alcohol or drug abuse like this. When a patient is diagnosed with epilepsy, there are certain things he has to take precaution of, like he has to take his medication regularly in the usual prescribed dose without changing it. Second thing, he has to avoid certain triggers, like he has to avoid missing the medication dose, lack of sleep, alcohol abuse, high-grade fever or infection. These are the usual trigger. Patients should avoid this. Flashing light can also trigger an episode of seizure, so flashing light should be avoided. A patient is having epilepsy should wear a medical alertness bracelet or a card whenever he goes. He should maintain an epilepsy diary where he can note down the epilepsy types, time and the associated features. Epilepsy patients should avoid climbing high altitude, working at high heights, should avoid swimming alone, should avoid contact sports like wrestling, playing football, and should avoid driving alone when he is taking anti-epileptic drug. There are certain myths about epilepsy. Some persons think epilepsy is contagious. No, it is never contagious. It doesn't spread from one person to another. Now we'll discuss about women with epilepsy. At present in India, there are approximately 27 lakh women who are suffering from epilepsy. Of them, 52% are in the reproductive age group. When a person with epilepsy is planning for pregnancy, she has to visit her neurologist and consult. Certain anti-epileptic drugs are teratogenic, means they can cause birth defect in a child. So the patient should switch to a safer anti-epileptic drug which can be safe for mother and the baby. So to conclude, epilepsy is a chronic condition. With the discovery of the newer generation anti-epileptic drugs, most patients can lead a full and normal life and can do his daily activities